What are the competencies of an assistential nurse? I noticed that many nurses don't know their real competencies. When I talk about competence, guys, I'm not judging anyone. I'm talking about the competence we need to understand in that assignment, in that role as a nurse. Right, so the nurse, most of the time, I talk, I listen to my students, and I realize that most of them don't know what their competence is when it comes to providing care. If you are a nursing technician, pay close attention to what I'm going to say here, because it will be useful. You need to understand what you should expect from your nurse. And for you who are a nurse, you need to think about where you need to focus more. That's the main point. All of this, folks, I teach to our outstanding nursing students. We have advanced training. There aren't any spots available right now, but just to make it clear, we already make this very clear. We teach this because it's very important for you to know what you need to focus on before studying things that don't make much sense. Maybe for the moment you're enjoying, don't forget to like and share with people you want who understand the importance of knowing your real care competence. Let's go. I was a care nurse working in the intensive care unit, I was a care nurse in the ward, and I was a care nurse in the emergency room. Whether you have a specialization or not, whether you are a specialist or not, you are still in care. You are a care nurse. So the first thing you need to get into your head is that you are a care nurse. He is there to provide care for the patient and the team in the department. There are 3 types of care he needs to provide: care for the patient, the team, and the department. What I notice the most is the desperation in the search for knowledge. For one of those 3 things I mentioned, the patient is in an endless search for knowledge to provide good care. The patient does not lead the team and does not manage the department. In other words, you will be a failed nurse because you need to have balance. In these 3 points, they are patient, team, and department. I mean, the unit where you work, you do 3 things. You need to understand that these 3 things are a big part of your daily routine. Unlike the nursing technician who works directly with the patient, the technician doesn't do all 3 tasks. He only has one responsibility as a technician. It focuses on the patient. The nursing technician is not focused on the team. The nursing technician is not focused on the department. The one who is focused on the department and the team is the nurse. So, be careful not to think that you're buying courses and improving your performance as a nurse. Actually, you're not improving as a nurse. You're strengthening one part and leaving 2 main ones out. And I say this with a lot of confidence. Most nurses have a deficit in leadership and management. Classic. I can say in percentage that patient care accounts for 30% of the knowledge you need to have, the other 70%. It's directed towards leading your team and managing the department. Managing the department includes your team and the patient. When I say managing the department, I don't mean the supervisor or coordinator. Their role is different, so don't confuse what the supervisor or the department coordinator does with your own responsibilities. So, for example, I start my shift at 7 a.m. and stay until 7 p.m. during the 12-hour shift. I manage my department in every way, so I'm the one doing the management there. But I don't manage my supervisor. I don't manage my coordinator. I manage what I need to, the progress there. I'll give you some examples. From the emergency room, a patient arrived with edema pulmonary needle. So having knowledge about that is important because you're going to delegate things for the nursing technician to do, and that's management. That's management. You're delegating something for him to do here with the patient. If you have to do something with the patient, you come here, which is direct care. So indirect care is management, but you need to have knowledge to delegate. Do this and that with the patient, monitor him, and handle his access and related tasks. So that delegation you're doing there, it's a form of management of the patient, okay? And then the leadership of the team is very important, because here's the thing, man, there are technicians who say this: I want to know if I can eat now, I'm going to have some coffee, when can I take my lunch break, what time? So you have to understand that this is part of the support. So even though it's already set that lunchtime will be from 11 to 12 for one group, from 12 to 1 for another, and from 1 to 2 for another group, you need to control this. You need to know why and if the emergency room is full and if any emergencies have arrived. The one who has to manage it is you can't. Simply, the shift is on fire and 3 technicians look at you and say, look, my lunch break is now at 11 o'clock, I'm going. And you just say, okay, we're screwed. No, man, you're a nurse, you guys can't go now. Look, the shift is on fire. We're going to reschedule your breaks for later. But right now, no one can go. And that's part of it. It's part of your leadership. It's part of your management. So that's why it's 70, because this happens all the time. But when is the shift ever calm? It's never calm. But that's when your reasoning ability comes in to think, wait a minute, the shift is not going to be calm. But how can I control it so that they will take your shift, they'll control it? How do I do that? Doing this without compromising patient safety, but also without abandoning my team. I also can't tell the team, look, guys, today no one is going to eat because there's no time, the hospital is full, the emergency room is like this, it's hectic. But there are times when you know you just can't go. It's that moment, man. Right now, you just can't go. Let's wait a bit. I have some things to take care of here. Soon it'll ease up. Okay, we'll manage here. But right now, it's not possible. But the one who needs to have this perspective is you. Nurse, you shouldn't leave this up to your supervisor or your coordinator. Because if you're leaving this up to him, man, what are you being? A nurse who only does procedures, admits patients, and answers the phone. So, what do you need? Your ability as a care nurse? Direct patient care, delegating tasks to the team, working with the patient, leading the team, checking how the department is doing, controlling everything within your reach, that's part of it. That's your responsibility. You can't assign that to someone else or leave it without responsibility, leave things hanging. People do whatever they want. During the shift, things happen, things go missing, processes go wrong, so you have to keep an eye on everything and also have a critical perspective. Just because it always works this way doesn't mean it can't change. Why not ask, why is it like this? Look, this isn't good. Let's suggest a meeting. Let's see if we can make a change. Look, if you're a real nurse, the kind of guy who wants to make a difference, you're going to look for things that can be improved, improvements, changes. Otherwise, you'll just accept everything as it is and that's it. It doesn't mean that what you suggest will be accepted, but at least you're suggesting something you saw that could be improved, you know? Do you want more content like this? If you want, let me know here, because I think this chat is interesting for you to really understand your role. If you need help or want supervision, coordination, or input from informal technicians in different sectors, let me know and we'll create the content for you. Thank you.